Welcome to the Clean and Nourish YouTube channel. I am April Eke, your holistic health practitioner, and today I will discuss with you all diverticular disease. And I know some of you out there may be diagnosed with diverticular disease, and you're not sure what it is. You're not clear on the difference between diverticulosis and diverticulitis. So hopefully by the end of this video, you have a better understanding of your condition and can clearly identify the difference between the two. So first, let's talk about what is a diverticulum. A diverticulum is a single pouch extending outward through the intestinal wall. It's usually found in the left side of the colon, which is your descending colon and your sigmoid colon. And in other words, another way of looking at it is a small sac-like protrusion out through the mucosa layer of your intestines. So, what do you call it when you have more than one diverticulum? That is called diverticula. If you have more than one outpouching, you refer to it as a diverticula. So what does this have to do with diverticulosis? Basically, diverticulosis is the condition of having diverticula. Diverticulosis usually does not come with symptoms, but it may come with gas and bloating with some people. Diverticulosis is common among the Western society. In the United States of America, 10% of people over 40 actually have diverticulosis, but most people remain unaffected by the diverticulosis, meaning they don't experience any flares. So what is diverticulitis? Diverticulitis is simply inflammation and or infection of the diverticula. Usually this is how somebody figures out that they have diverticulitis. You become inflamed or infected and you experience symptoms like pain, constipation, nausea, fever, something bad enough to where you go to the doctor, even go to the ER, and they do tests and they determine that you have diverticulitis. The normal medical treatment for diverticulitis includes antibiotics, soft fiber diet, or even a liquid diet. And antibiotics, of course, are to treat the infection. And the diet of soft fiber and liquid is to give your intestines a break, give them a rest so that they can heal and repair. So, what causes diverticulosis and diverticulitis? The cause has not been studied, but it is thought to be caused by constipation. Chronic constipation, that is. Usually people with diverticulitis or diverticulosis experience chronic constipation for years to even decades. And the problem is when you have hardened stool sitting in your gut, your intestines are trying to work harder and harder to push that stool through. And in the process, your muscular layer of your intestinal wall becomes thicker, which increases the pressure on the intestinal wall. And in areas where that muscular layer is weakened, these pouches, these diverticulum, are created. And that's the condition of diverticulosis. And a lot of people in America are on the SAD diet, and they experience constipation due to low fiber diets. And also a lot of people are just simply dehydrated and they don't even know it. Another possible cause is suspected to be NSAIDs like aspirin, because these medications actually can further weaken the intestinal wall by thinning out that mucosa layer. If you take it daily, if you take an aspirin daily, or even weekly, over time, that can have a negative impact on your intestine. So, what's a flare-up? Some people with diverticulitis experience flares regularly. Some hardly ever experience flares. In between flares, what you want to do, though, is establish a high fiber diet. Make sure you're staying hydrated. Most people, I know the recommended daily value of water is only 64 ounces, but that is really not enough water considering what we eat. A lot of people eat dehydrated foods. So if you have diverticulosis and you want to minimize flares, you want to maintain a high fiber diet and proper hydration, and be sure that you are having a bowel movement every day. You should actually have a bowel movement as often as you eat, right? So this doesn't mean right after you eat, but if you do consume 2 meals a day, you should have 2 bowel movements a day, because you produce waste from every meal that you eat, and it needs to be coming out. You don't want to hold on to it. And you also want to make sure that you consume hydrating beverages, unlike coffee, unlike dark tea, because caffeine, alcohol, or sugary drinks like a Coca-Cola can actually be dehydrating to the body, which can add to constipation. So there you have it, diverticulitis and diverticulosis. Hopefully that clears things up for you, and stay tuned for our next video that I will go further into discussing how to prevent flares, what to do when you're having a flare to minimize the duration of it. Hopefully this helps you. If you have any questions, send me an email at info@cleanandnourish.com, and subscribe, share, and comment. Thank you.